Welcome to the No Nonsense Guide to Type 2 Diabetes. Type 2 is a complex disorder which alters the body's ability to deal with sugar. It mainly affects adults, but very occasionally it affects children. Over 2 million people in the UK are thought to have diabetes. Although there are several different types of diabetes, 7 out of 8 people have type 2 diabetes. You should, by the end of this programme, have a far better understanding of type 2 diabetes and its long-term consequences. We have 3 reporters with us, Sarah, Marianne and Angela, who will be bringing us the news and information from various parts of the country.
Coming up, diagnosis. What causes diabetes? Adopting a healthier lifestyle. Managing your diabetes. Monitoring and complications. But first, to give you a better understanding of type 2, we must take a look at how your body deals with food. The human body is very efficient at processing food. When you eat food, your body breaks it down into its component parts, and one of these components is glucose. Glucose, a type of sugar, is needed for energy. Your body usually controls the level of glucose in your blood very tightly, mostly keeping the concentration between 4 and 7 millimoles per litre. Insulin is a hormone produced by the pancreas in response to changes in blood glucose. Insulin lowers the blood glucose level by making the muscles, fat and your liver take up the glucose from the blood in order to use the sugar to produce energy. In certain circumstances, a situation called insulin resistance, the muscles, liver and fat do not respond to insulin as well as they should. When this happens, the body produces more insulin to lower the glucose. Eventually, the pancreas is unable to produce enough insulin to overcome the resistance, and blood glucose increases, sometimes despite high insulin levels. That is how this form of diabetes develops. When the pancreas cannot produce as much insulin as the body needs to keep the glucose controlled. Initially, patients with type 2 diabetes may have no symptoms, but as time passes, the patient may develop symptoms such as blurred vision, a need for frequent urination, as well as regularly feeling tired and thirsty. These symptoms should alert you or your doctor to the fact that you may have diabetes. What symptoms did you have when you were first diagnosed?
At the very beginning in 1976, I put on an awful lot of weight, excessive thirst, and I used to tell people the bed waved to me, even if I just walked into the bedroom. I just wanted to sleep all the time.
Symptoms of great lethargy, being very tired, and I eventually kept saying to the doctor that I was constantly tired, and I got the various tests, and then eventually came the news that I was diabetic.
I didn't have any that I was aware of, but I was picked up, I was in hospital having an angiogram, and the nurse came running through and she said, "Why didn't you tell us you were diabetic?" And I said, "I'm not diabetic." And she announced that I was, so that was how it was picked up, but I wasn't aware that I had a problem before that.
What are the other symptoms of type 2 diabetes?
As you just mentioned, patients can commonly present with the classical symptoms of high blood sugar, and a lot of patients will recognise these symptoms. Sometimes these symptoms can come on so slowly that patients attribute them to getting older, stress or possibly work problems, and only present to their surgery when the symptoms are quite marked. However, a large number of diabetic patients do not know that they have diabetes. Patients can be picked up at routine urine or blood testing when they present with other medical problems to their doctor or practice nurse. A number of general practices already routinely test for diabetes in patients who've had a heart attack or a stroke. It would appear to become less common, but patients can sometimes present with diabetic complications. For instance, patients present to the GP with high blood pressure, or to the optician with changes in their eyes.
TXAUV. Now this one's getting H as the last letter.
Okay.
I've also known patients to present to the chiropodist with foot ulcers. These problems would suggest that diabetes has been around for some time before the diagnosis is made. But let me just stress that I believe that this is much less common nowadays. I believe that we're a lot better at screening for diabetes and picking up diabetes much earlier.
Receiving a diagnosis of this condition can be difficult to come to terms with. Type 2 diabetes is a lifelong chronic condition against which many people rebel at first.
What was it like for you when you were first told that you had diabetes?
Well, it was a huge shock. I didn't expect it, and it was a huge shock.
I was shocked actually. What happened was I was a young guy. So I said, which kind of, I heard about this disease before. So I thought, must be I'm getting any wrong kind of disease, you know. I was shocked really.
I was shocked, and I was, disbelief really, because I always thought it was an older person's illness, again, type 2. So, and younger people got type 1.
I was really shocked and very upset.
As a psychologist, what are the common difficulties people have when they are diagnosed with type 2 diabetes?
Well, people react in different ways and some have more trouble than others, but fairly typical responses would be things like anxiety, stress, shock, numbness, anger, frustration and feeling sad. There's nothing odd or unusual about that. It's just typical, natural human responses to what is for many a life-changing event.
Lots of factors will influence how people initially react. One important factor is what people already know or think they know about diabetes. For example, they might know of someone who has had a particularly difficult time with diabetes, perhaps a family member or friend. Perhaps they have read about someone in a magazine article. A little knowledge is a dangerous thing, and this little bit of knowledge might make some people quite anxious or even frightened. As a result, they may be reluctant to ask questions when they see their GP or visit their local diabetes clinic.
What types of things get in the way of people managing their diabetes well?
The kinds of treatments that we suggest for people with type 2 diabetes are naturally quite demanding. Usually taking tablets, maybe insulin, and making fairly big changes to the lifestyle, like stopping smoking, losing weight, increasing exercise levels and changing diet to some extent. Trying to control blood sugars can be a pretty tough job, and understandably some people can find that a bit of a pain and difficult to keep up day in, day out.
Other problems conspire to make life difficult for people who have received their type 2 diabetes diagnosis. Obviously, taking control over factors affecting the disease is vitally important for the sufferer, but this manner of taking care of yourself can be affected by another subtle illness. Clinical depression. This is not just a kind of sadness we all get from time to time, but a clinical syndrome which is characterized by symptoms such as fatigue, lack of energy, sleeplessness, feelings of profound sadness and tearfulness, and a loss of interest in things that have been really enjoyable in the past. Clinical depression is very common among people with type 2 diabetes. If someone thinks they have clinical depression, they should definitely see their GP or speak to someone at their diabetes clinic. There are good treatments for depression these days, and if the depression can be lifted, then certainly you will feel much happier in your life generally, and managing your diabetes will be considerably easier. What's the worst thing about having diabetes?
Probably it is having to sort of always, watch what you eat and try and be that bit healthier. I mean, let's face it, the natural state is not to want to exercise and eat well, but that's probably the hardest bit of it.
It affects my work and the things that I enjoy eating, I can't enjoy now.
I think really the stress, you know, trying to keep it under control, your blood sugars, your weight, that really mounts up at times.
Various factors can contribute to someone getting diabetes. Our reporter Angela has consultant Dr. Andrew Collier with her to explain.
If your grandmother has type 2 diabetes, is there a chance you will get it?
It's impossible to give an exact figure. However, the risk will be higher than in the non-diabetic population. The genetics of type 2 diabetes have not been as well defined as type 1 diabetes. That is what we used to call insulin-dependent diabetes. Type 2 diabetes is believed to arise as a combination of genetic and environmental factors. Patients who have a parent or a brother or sister with type 2 diabetes have a higher risk of developing type 2 diabetes. The prevalence of type 2 diabetes varies more than tenfold between the highest and lowest risk populations. Diabetes is particularly common in North American Indians, Australian Aborigines, and of course certain ethnic communities in this country. Around 3.5 to 4% of the Scottish population know that they have type 2 diabetes.
Does anyone in your family have diabetes?
Yeah, my mother had it and all my aunts had it. Some of them are still alive, some of them are dead, but I've been waiting it coming. I mean, I thought it came years and years ago, but I've been waiting it coming.
Right.
Why does weight gain and lack of exercise promote the onset of diabetes?
Type 2 diabetes is associated with insulin resistance, and this in turn is associated with being overweight or obese. Obesity is much more common in childhood now, with bigger babies and changes in the way young people behave, such as watching more TV. As a population, we eat more junk food and take less exercise. This often continues into adulthood, and as a result we have a population who are getting heavier. Food consumption has increased with an increased supply of food at a lower cost, with supersized portions being promoted by junk food outlets. As we will come back to later, we all need to move a little more and eat a little less.
Why is type 2 diabetes becoming more common?
This question has already been answered in part. There are a number of theories. The most commonly accepted theory relates to the high prevalence of genetic factors, which in the past has helped us to survive long periods of low food supply. However, this genetic trait appears to become harmful when the population is exposed to abundant food supplies and reduce their physical activity. As a result of this, people put on weight, become more insulin resistant, and type 2 diabetes is therefore more common.
50% of the Scottish population is overweight, and everyone, not just those with diabetes, would benefit from a healthy diet and more physical activity. Taking exercise and controlling your weight is the best thing you can do, not only to control your diabetes, but it'll also improve your chances of a healthier future. We sent Sarah to interview consultant Dr. Anne Gold, who has an interest in lifestyle management.
Thanks, Alison. We're here in Aberdeen to meet Dr. Anne Gold, who is a consultant in diabetes at the Aberdeen Royal Infirmary. Anne, what are the beneficial effects of exercise and healthy eating?
Well, I think first and foremost, people who take regular exercise and eat healthily feel better. They've got higher self-esteem, they're less depressed and generally feel much better about themselves. If we think about healthy eating for a start, and by healthy eating you mean a balanced diet, there's no treats that you can't have, it's just everything's in moderation. That if you eat healthily when previously you've not been eating a healthy diet, you might lose weight. But even if you don't lose weight, you can still benefit your diabetes. You can put less of a strain on the pancreas by allowing your own insulin to work more efficiently, and that improves your overall blood sugar control. If you alter the amount and the type of fat that you eat, that might also help you lose weight, can benefit your heart, and reducing your salt intake can lower your risk of high blood pressure in the future. Thinking about physical activity, as I said, that all the studies show that people who exercise regularly are less depressed and feel good. We often think that physical activity is there to help people lose weight, but even if you don't lose weight by exercising, it can benefit your diabetes. By taking regular exercise, you improve the way that your own insulin works, which reduces the strain on the pancreas, improves your overall blood sugar control. You lower your blood pressure by exercising regularly, and your risk of heart attacks in the future is greatly reduced.
Do you watch what you eat?
Yes, I do. I eat a lot of fruit, not big portions of anything sweet. Small portions if I'm out for dinner or something, I'll have a small portion. Other than that, I just watch what I'm eating and the sweet things.
If somebody comes home from work and they feel quite tired, how would you encourage them to go out and do some exercise?
Well, I mean, I know from personal experience, often the last thing you want to do when you come home from work is to go out and do any exercise. But if you do, you actually feel better. It costs you energy to exercise, and by that it might be just going for a brisk walk. It doesn't have to be going to the gym or anything like that. It costs you energy, but at the end of it you come back and you feel as if you've got more energy, which makes you more able to do the activities of just daily living. So exercise or physical activity can be fun, it can be sociable, it can be free, and it's certainly worth considering to help in the management of your diabetes.
Here are two ladies talking to each other. This is not that unusual, except that the lady on the right has lost weight. The amount of weight she has lost is the same as the weight of the lady on the left.
Has weight always been a problem for you, or was it due to your diabetes?
I've had my daughter at 17, and when I had her, I stayed at home and was just mum, and I comfort ate when I was bored, so the weight gradually became more of a problem.
Your weight finally became 23 stone. What was the main factor which led you to lose 8 stone in weight?
Diabetes, and the fact that when I was diagnosed with it, they said to me that they could give me tablets, but there was no point if I was going to stay eating the way I was. So it was a stark choice. You can gain the weight or lose it, and I decided to lose it.
What's the best thing about losing so much weight?
More pride in my appearance, more confidence, and getting clothes off the peg instead of through other ways.
Has losing weight helped your diabetes?
Yes, it's under control. It's an average of 6.5 now, which is in the normal range.
Do you feel being diagnosed with diabetes was a turning point in your life?
Yes, definitely. I think it needed me to get diabetes for me to actually lose the weight, because I think I probably would have still carried on old ways, again, old bad habits.
We now cross the country to Dundee to talk to sports scientist Dr. Alison Kirk.
Thanks, Alison. We're outside Dundee University's Institute of Sport and Exercise, where coordinator Dr. Alison Kirk will tell us more about a unique new exercise programme for people with type 2 diabetes.
Your exercise and education classes are specifically for people with type 2 diabetes. How successful has it been?
I think it's been a very successful programme that we've set up. We've actually just recently evaluated the programme so that we can give the report back to Diabetes UK, who have funded it. And we've seen lots of improvements in their physical activity levels, their fitness levels, and their diabetes control as well. Also seen a lot of improvements in their cardiovascular risk factors. So overall, it's been very successful. And from that point, we've actually wanted to now keep it running, and we'll run it, and continuously.
How much physical activity should people with type 2 diabetes do?
The recommendation is really the same for the general population as what it is for people with type 2 diabetes. That is that they should try and accumulate 30 minutes or more of moderate intensity physical activity most days of the week. We do, however, say if people who are being very, very inactive and they feel that that's too high a level of activity, that any increase in physical activity will be beneficial than none at all. So what the pedometers do, basically, it measure your step counts. Okay, so the number of steps that you're taking when you're walking or jogging or going up and down stairs. Okay, if we plug in your stride length to this, okay, so how far you cover when you're walking, we can also work out the distance that you've covered when you're walking. Okay, if we plug in weight as well, you can actually work out the calories that you've burned up when you're walking. Okay. This is a simple model where you can't really go wrong with pressing the buttons, and it just measures step counts. Okay?
What sorts of activities would be appropriate for people with type 2 diabetes?
Really, if they've got no complications of diabetes, then it's purely a matter of personal preference, and what I would encourage people to do is activities that they enjoy, that way they'll stick at it. If people, however, do have complications of diabetes, for example, eye damage or heart conditions, there can be certain activities that are maybe contraindicated, or some activities that would be better than others. So for that reason, I would recommend that they speak to the diabetes care team and get some guidance on that.
How much physical activity do you do a week?
I try to swim at least 3 times a week and go to the gym whenever I can. Try to be aware to walk rather than use the car, and of course I understand that housework counts, so do quite a lot of housework every week as well.
Well, the most physical I would say was I play golf 3 times a week, a Monday, a Wednesday and a Saturday. So, and I reckon I always count it as a 6-mile walk each time I play a round of golf, so I do about 18-20 miles a week, and we've got 2 lovely parks in here that I can walk through, and I usually do that, I walk round the park at least once a week.
Moving down to Ayrshire, we can now join Angela, who's going to let us into some secrets for healthy eating.
Thanks, Alison. We're now down at Tune at the Lochgreen House Hotel to have a word with award-winning chef Willie Pike. Willie, are people going to think the food here is far too rich and fattening?
Certainly not. I mean, there's a great emphasis now on using good, obviously local produce, but being extremely careful about the fat content and the sugar content of certain products. I mean, there's no reason why you can't come here for breakfast and have a nice fruit platter, very refreshing with you, with natural yogurt or low-fat creme fraiche, or even things like substantial things like porridge, but don't just have it with on its own. Why not put a nice wee fruit compote in it or whatever, and very, very nice to eat. So I think it's all about being selective.
Now we're having a salad for our lunch. This is obviously quite common in most menus nowadays, isn't it?
Yes, it is. No, very, very popular here. I mean, if we could use fish, we can use smoked salmon and just warm it. You can use all sorts of different chicken and bits and pieces. Very, very popular.
And how did you cook the chicken?
Well, the chicken was basically cooked. Again, it's all about making sure the food's not bland. I used like a kind of Cajun seasoning, and I seasoned it up with the Cajun seasoning before I cooked it. And I cooked it in vegetable oil, and turned it over and finished it in the oven for a couple of minutes. Right. As a chef, you don't want to overcook it, make it dry, but at the same time, it should be cooked. And then taken it out, and then it's very, very important to drain off and dry off any surface fat.
Yes, to make it as low fat as possible.
Sure, and I removed the skin and all that stuff before we started, so it was really nice and tasty.
Yeah, and obviously with people being diabetic, it's important that they get a balanced diet. And so with this meal, they're getting the protein from the chicken, and the potatoes are providing the carbohydrate, and then the vegetables and the salad. So it's a good source.
I mean, most people would stay away from a fried potato. These are Ayrshire potatoes that were pre-boiled, and they were cooled, halved, and then they were pan-fried again in vegetable oil. But pan-fried to the point where they're nice and crisp, so you get a nice eating experience. It's really lovely caramelisation. And then the most important thing, again, is to drain them. So drain them in a cloth, and then just use them to assemble your salad. And as you say, that's the protein, the carbohydrate, and your kind of vegetable stroke fruit element. So it's a nice eating experience.
So we're now having a starter for a main course. What have you cooked for us now?
Well, basically it's like that. It's when you have that experience and you're looking at eating 3 courses for dinner. I think it's really a matter of being extremely selective with the menu, because there will be things like maybe a wild mushroom risotto, which is finished with parmesan, possibly some whipped cream and all that stuff, which is very, very heavy for you. Whereas what we've done here is we've cooked some couscous in some chicken stock, and I've cooked down some spinach, just slightly wilted in the pan. I mean, it takes absolutely no cooking whatsoever. The sea bass, which is it's not a fatty fish by any means, but crisped up the outside skin and just finished under the grill for a few seconds. But langoustine, gently cooked on top, all drained of any fat. And probably one of the keys here really is that we've used a tomato. It's a tomato and lemongrass sauce, which is obviously infused with flavour with lemongrass, but kind of tomato base rather than a cream base. So probably calorific value-wise, I wouldn't say it's a lot in it.
No, I'd say it's quite low in fat, which is obviously where a lot of calories come from in starches. So if it's low in that, then you tend to find that it will be a low-fat choice.
So what you're hoping is somebody can come and enjoy 3 courses and not feel as though they're kind of breaking all the rules.
Exactly. And this is our main meal. What have we got here?
Well, what we've got is, I mean, again, it's a special event. You're out, you're having dinner. This is fillet beef, and basically the fillet it's extremely lean. It's a lean piece of meat. Some pieces of beef are extremely fatty, but this is an extremely lean piece of meat, and it's been sealed and grilled, still underdone. I would think medium rare as it should be, as I prepare it, as most chefs do. But that's good. We've served that on a little lentil de pie. There's a wee bit of pulse in there. There's some fresh root vegetables. I've used some green vegetables there, but I've wrapped them in Ayrshire bacon. But I've made sure, as we do, is make sure we remove all the kind of fat from the Ayrshire bacon. It's just wrapped up and pan fried. The potato is quite interesting because what happens in lots of establishments, people make a kind of mashed cream potato. Yes. So you end up putting lots of butter in it and all sorts of cream and stuff. Whereas what we've did here, we've actually sealed it and braised it in chicken stock.
Right,
so
there's no fat in it?
There's no fat in it. It was sealed in fat, but then it was kind of patted off really and then cooked in its own stock, cooking some chicken stock. So it's got a lot of essence of flavour. And we've really just served it with the reduced Madeira sauce.
No, as a dietitian, I mean, obviously this is very important as well. You know, making sure you've got all the food groups and it's there, and that's very important, getting the fibre from the vegetables and the fruit, the protein from your steak, which is obviously low fat, and then also the potatoes for your carbohydrates. So it's a balanced meal. Yeah.
Now over to the capital to talk with consultant Dr. John McKnight, who's going to tell us about the progression of diabetes.
Dr. McKnight, what causes patients to need further treatment other than diet and exercise?
Well, we've already discussed, Sarah, that people with diabetes develop diabetes because they can't make as much insulin as their body needs. And because they can't do this, their blood sugars rise. Now, with diet and exercise, you can reduce the amount of insulin that your body needs. But sometimes people can't manage to keep weight off. Sometimes, for very good reasons, they're not able to exercise. And also, as people become older, there is a tendency for the body to be able to make less insulin. Hello, Mr. Johnson.
Hello, Dr. Munday.
How have things been?
Not too bad, but recently I've noticed my blood's gone up.
What did it used to be before breakfast?
It used to be about 6.2, 6.4.
Right. What sort of results are you getting now?
Up to about 9.
That's interesting because the HbA1c test, this marker of the average blood sugar, has also increased a little as well. It's up to 8.3%. So I think the diabetes isn't as well controlled as it was. So this balance between the amount of insulin you make and the amount of insulin you need is dynamic and may change. And there's a tendency, therefore, for diabetes to progress. We can deal with this partly by giving tablets. It looks as though you've reached a stage with these results that maybe we need some more treatment. And I think we should maybe start some tablet therapy to try and make sure that we get the blood sugars down and keep this under better control. I think initially the tablet I would try is one called metformin. This is a tablet which you should take initially once a day after the main meal of the day, and then increase to one twice a day. And I think we should then see through your checking yourself at home but also with a repeat HbA1c test in a few months, we'll be able to tell if that's working well enough or not.
I'm on an atenolol for high blood pressure. It wouldn't affect it.
That will have no effect with that at all. And there are tablets such as metformin or glitazones which increase the sensitivity of the body to insulin so that they need less insulin. And there are some such as sulfonylureas like gliclazide or glipizide which stimulate the pancreas to make more insulin. But as time goes on, despite best efforts by the patients, sometimes they just can't make as much insulin as they need, and insulin treatment is required. We can monitor to see how well things are going over a period of time using HbA1c or home blood glucose monitoring. And if the person is doing the best they can with diet and exercise and pills, and we see that this just isn't working, then a decision needs to be made to start insulin. Insulin has to be given by injection, and there are a whole range of different insulins now. Your doctor or the nurse specialist that's looking after you would decide with you what the best type of insulin is for your particular circumstance.
It's all very well being told what to do and how to do it, but as a patient, you will have to manage your own diabetes. We sent Sarah to the Isle of Arran to see how type 2 patients cope with daily life on an island.
Arran has a population of around 5,000 people. 3.4% of islanders have type 2 diabetes.